Dr. Prucz. We're in the operating room today with a patient who's had obviously multiple abdominal procedures, and he has a very large hernia, as you see here. So the general surgery team has asked me to try to fix this, and the way that I've done that is I've elevated the skin off of what's called the anterior rectus sheath, or what he has left of it, and separated the rectus muscle from the external oblique muscle. So if you see a cut right here, it's because I've separated the external oblique muscle from the rectus muscle and the internal oblique muscle. And I've done that on both sides. And what that allows you to do, it's called a component separation. When I walked in the room, this was like this. But now, I can take both of these and advance everything to the middle, because I've separated things, to actually get coverage of this hernia. So we're gonna go ahead and do that now that we've done our component separations on both sides. And then we're gonna put a mesh in to reinforce everything. And then one day, I'm gonna get rid of all of this scar tissue by doing an abdominoplasty, but he's probably about 6 months out from that. We finished repairing that large hernia that you saw previously, and as you see, I've maintained the belly button, because I am gonna do a tummy tuck one day on this patient. So I have to leave this somewhat attached in order to maintain the vascular blood supply so that I can use it later. And now we're gonna take a mesh, and we're gonna put a mesh across this whole thing in order to reinforce the repair that we just did.